To mid-morning. Today we're learning about Kentucky's only independently owned hyperbaric oxygen therapy facility.
Here to tell us more about it is Drew Watts with Restorative Oxygen Care. Drew, thank you so much for being here with us today. Tell us about this facility.
So as you said, hyperbarics are usually limited to hospital settings, and Restorative Oxygen Care is the only independently owned and operated hyperbaric oxygen facility in the state. And in terms of the number of chambers that we have, we're also the largest.
How does that treatment work? Do people, I guess, how large is the chamber, and then how long do people normally stay in?
Right, so we have 4 chambers, and the chambers are 34 inches in diameter, so large enough for most people, and you basically just slide in a gurney. People have this idea of hyperbarics, of these old steel chambers that have a little porthole in there. Ours are clear, 2-inch thick acrylic, and you can see out. We have TVs over the chambers, so patients can watch movies or take a nap or TV shows if they like. The treatments are approximately 2 hours, depending on the indication, and treatment courses can last anywhere from 20 to 40 sessions typically.
What do you treat in these sessions?
So hyperbaric oxygen therapy is approved for 14 different indications. In Kentucky, we only see a few of those. So the things that we see primarily are non-healing wounds, so that could be diabetic or otherwise, compromised skin grafts and flaps, so that would result from surgery, delayed radiation injuries, which is a big one that we see because Kentucky has such high cancer rates. We also see some patients with hearing loss and chronic refractory osteomyelitis, which is a bone infection that is sort of resistant to other treatments. And we've also, because we're independently owned and operated, have been able to get some other conditions approved, like traumatic brain injury, chronic migraines, rheumatoid arthritis, things like that.
How does oxygen therapy help treat these issues?
That's a great question. So the air that we're breathing right now is approximately 21% oxygen and approximately 1 atmosphere. So our chambers are pressurized to 100% oxygen and up to 3 atmospheres of pressure. So essentially what that does is forces more oxygen into the tissues where they might not ordinarily be able to get oxygen. It essentially liquefies the oxygen in the plasma as well. So where it's normally bound to like the red blood cells, it actually liquefies it so it sort of can get into areas where the oxygen wouldn't normally go. That's
amazing. Now, is this covered by insurance?
It is, yes. So the 14 approved indications are covered by insurance, including Medicare and Medicaid. There are certain indications that we have been able to get approved that are not on that approved list. Like I said, some of the traumatic brain injuries and the other things. But yes, insurance will pay for those things that are on that approved list.
Okay, we've got the website up there on your screen. Take a look at it. And thank you so much for coming to talk to us. Very fascinating.
Thank you all for having us. We appreciate it.